Hey guys, this is 101nursing.com. My name is Priscilla, and today we will be talking about chronic renal failure, chronic renal disease, or end-stage kidney disease or renal disease. It's the kidneys, and it's a chronic failure. How about that? The definitions of this disorder is it's a progressive and it's irreversible. That's one thing. Acute is reversible, but chronic is irreversible, and the kidneys are not functioning at their best capacity. It results in uremia, and the major causes of this is excessively high hypertension and uncontrolled diabetes mellitus and taxus hereditary diseases. But the major game changers are your chronic hypertensives and uncontrolled, and your uncontrolled diabetes mellitus patients. So there are 5 stages of chronic renal failure. 5 stages. Stage 1 and 2 are basically non-specific interventions, and you see the trends and you see the labs, and your primary health provider is still going to be taking care of these patients. Your second stage is stage 3 and A and 3B, and it's still managed by your primary care provider, but you're seeing your labs, your BUN, your creatinine, you're getting a decreased urine output. Stage 4, the third stage, or stage 4, is going to be a referral to your renal physician, and they'll start taking it from there. And stage 5 is when you either need renal replacement therapy, dialysis, or a transplant. And renal replacement therapy can mean 3 different types of dialysis, and we're going to go into that right now. What are you going to see with your chronic renal failure patients? Well, you're going to see hypertension, you're going to see pitting edema, you're going to see periorbital edema. These patients have not been taking care of themselves, they have not been compliant. So you're going to see these trends. It's going to start going up and up and up. Pericardial, friction rub, engorged neck veins. At first you can start seeing them trying to use medications, but medications could only go so far. What are you going to see in their integumentary system? On their skin is going to be very dry and flaky, grayish, brownish skin. It's going to be a little jaundiced, but that's not really what we're looking for. You're going to see ecchymosis. It's easily bruising, thin and brittle hair because you're not getting as much perfusion as we would like to. You're going to see crackles for pulmonary. You're going to hear crackles, not see crackles. You're going to hear thick sputum, and they're going to try to cough it up, but they can't because they can't really thin out that sputum. Shortness of breath. You might see Kussmaul type respirations. GI. You're going to hear, or you're going to see or smell, a uremic froth, and that's like a ammonia type odor that comes off because you still have that waste within your body if the patient is not on dialysis. They're going to have anuria, meaning no peeing or low peeing. It's about 30 milliliters. It's really nothing. You're going to see ulcers and bleeding, nausea, vomiting, constipation or diarrhea, bleeding from the GI tract. Neurologic areas, you can see weakness, fatigue. I really love this picture. It just really breaks it down. Confusion. Why do you think we would see these things? Because they have a buildup of waste within the body. Restlessness, seizures, because we have excess potassium and sodium, and that's going to throw up our whole metabolic system. Skeletal muscles, you're going to see muscle cramping, loss of muscle strength, foot drop, reproductive, you can see amenorrhea, so no menstruation, testicular atrophy. What diagnosis test are we going to use? We're going to use GFR, BUN, creatinine. Your specific gravity, potassium, you're going to see phosphorus testing. What is our goal for this area? So we're going to just jump right into stage 5 end stage renal disease. You're going to want to slowly progress to end stage renal disease. A lot of complications that we need to treat. It's going to be the hyperkalemia, and that can be treated with K-acylate. That can be treated with IV glucose, insulin glucose. It's not your long acting, and that's to allow potassium to go into the cells, and then your calcium gluconate as well. You're going to see pericarditis, and you're going to want to treat that. That's usually indication of dialysis. When you see that, it's indication that you need to start dialysis sooner. You're going to see anemia because the kidneys produce erythropoietin, and if erythropoietin is not being adequately produced, you're going to get anemia, not enough blood. You're going to have bone diseases due to high phosphorus in the body. Everything has phosphorus in it. So how are we going to treat all of this? We're going to do our dietary interventions. For stage 3 to 5, we're probably going to have a protein restricted diet, high biogenic protein like your eggs, because it has more than just protein in it. It has various different types of minerals and vitamins that will help within your body. You're gonna have to be in a protein restricted diet. Multivitamins mean giving. Since phosphorus is in every single food that we use, is in every single food that we eat, they're going to have to take a phosphorus binding agent, such like Tums, with or after meals, so that they can basically poop it out or digest it out, because high phosphorus level is not good for these patients. And then lastly, we're going to be giving them a list of foods that they can eat. So phosphorus-free foods are going to be your butter, margarine, and oil. Those are free of phosphorus. Other than that, everything else has lots and lots of phosphorus within it. They can't no longer have cheese, chocolate, cream, soup, dried beans, and peas. They can't have ice cream, milk, nuts, and peanut butter. And no wonder a lot of dialysis patients are not compliant, because who wants to live a life that isn't with their favorite items and their favorite food? I surely don't. And even if I could, it's really hard to do that. But we still want to give them alternatives to the foods that they want to eat, so that they wouldn't feel like they're trading their life away for their health, which is important. But you gotta live. You have to live. So we're going to get into dialysis and the 3 different types of dialysis, as well as transplants. But that's it for chronic renal failure. Thank you very much.